this edition of 12 on Health. You're watching News 12 Connecticut as local news gets. Now, varicose veins can make people self-conscious about their legs, especially at this time of year when we're wearing shorts and soon wearing bathing suits. And while not all varicose veins can be erased completely, there are procedures that can make a dramatic difference. For the latest, we are joined by Dr. Joya Riccio of Riccio, MD and Associates Radiology. And Ruccio's Vein Center is in Fairfield, and the doctors also have offices in Bridgeport, Shelton, and Stratford. Lots of work out there. The Vein Center immediately busy?
It's picking up now because people are, as you said, starting to think about shorts and bathing suit weather, and oh no, I don't want to pull my legs out again, you know, because they're embarrassed by the way their legs look.
And it's a bummer because it's uncomfortable to wear long pants, you know, during those hot days. It seems a shame they can't relax and forget about it.
Exactly.
Is everyone a candidate for getting rid of varicose veins?
It depends on the degree of the severity as to what we will do to treat them, but there's something that we can do for almost everybody.
Okay.
What people don't understand also is the pain associated with the varicose veins, because a lot of people underestimate that. They go, oh, I don't like the way it looks, but it really is uncomfortable. Your legs are tired by the end of the day. A lot of people have swelling.
And is that over time it gets more painful?
Absolutely.
Achy?
Absolutely. And it's people that are on their feet all day, so they attribute it to the fact that, oh, well, I'm on my feet all day, and that's certainly why my legs are sore and achy, but a lot of times it's actually because of the veins.
For that reason, can it legitimately be covered by health insurance?
Absolutely. Absolutely. It's a lengthy process. There are things that have to be done before the insurance company will approve it, and rightly so. First, you have to be evaluated. The reflux has to be proven, and we do that with an ultrasound examination. We just look at your veins, and we can see exactly where the weaknesses are in your venous system of your leg. And then stockings are the best defense against the varicose veins, mostly for
those
comfort.
Thick compression hose.
Yeah, and that's probably the hardest part about the varicose veins, because people don't, and they're unsightly, and oh no, and everybody's going to know I have a problem when they see these, but it makes a world of difference for most people.
Okay, so if somebody's thinking about getting a procedure done to remove their varicose veins, they want to get to the doctor sooner rather than later to get that process underway.
Exactly.
With the insurance company.
And basically, from the initial ultrasound examination, we start the ball rolling. We'll give you, the sizing for the hose, and as soon as you start wearing the hose, it's considered the first day of your conservative therapy. So, and it's most insurance companies, it's about 3 months, but
okay.
It varies from insurance company to insurance company.
Very good to know. We want to show folks some examples of patients before and after. Here's before. This is a very severe case.
Yeah.
Do you think something like that occurred during a pregnancy?
It absolutely. It's a very common cause of these manifestations. They tend to be hereditary, so if mom has them, you might end up with them.
What was done for her?
She had what we call endovenous laser ablation therapy, which is just a fancy way of saying she had a laser therapy, where a small incision was made just below the knee, and the laser was sort of dragged through that loopy varicose vein and closed off.
So it didn't even, and this is another case of that same therapy, you close off the vein, and therefore it no longer pulls up that blood?
Exactly.
Now, a lot of people consider varicose veins an important part of their system in general, are they?
Not really. What they are a reflection of the fact that your venous system is not working properly. So it's kind of like an overflow valve. So what happens is these veins get dilated because the blood has no place to go. And what we do is we close that off. That gets rid of the escape hatch, and then we want you to wear the stockings to help activate the pump again.
Okay.
So your veins start working better. After the procedure.
But those veins are doing nothing productive for your body. That's why in the past you yanked them out.
Yes. Yeah.
What's the recovery time for this kind of laser therapy?
You're up and walking as soon as the procedure's done, believe it or not. As a matter of fact, actually most people say it feels better when they walk, because basically what you're doing is you're sort of closing the big droopy vein down, and you're reactivating your normal venous system.
Isn't that something?
Yeah. So we actually have you walk about 20 minutes right after the procedure, whether it's walking around the office or if it's nice out, walk around the buildings, and
That helps them with recovery?
Absolutely.
We want to show another before and after. It really is remarkable. Obviously, we're looking at some very dramatic befores. Some people will have much less severe cases.
Absolutely. And a lot of times it's just pain.
Oh, okay.
So a lot of people will present with pain, but they'll say, gee, it feels better if I elevate my legs, or it doesn't bother me in the morning, it bothers me at the end of the day.
Right.
And then we'll do the ultrasound and we'll say, wow, there's significant reflux, even though they may not have the bulgy veins yet,
I spoke to a young woman who wants to get this done, but I understand her doctor told her, you're planning to have children, aren't you? And she said yes. And the doctor said, why don't you wait until after you have your children?
Mm-hmm.
Why?
It becomes worse with pregnancy because, as you can imagine, you have an increased load, whether it's the weight that you gain from the pregnancy or the baby itself and the baby's position in your uterus, whether it's compressing the venous system, can help with the backflow. If you've already got it, it's going to get worse.
Well, why not close off those veins and avoid the whole bigger issue later?
You can. Unfortunately, varicose veins are more of a chronic kind of problem.
So they come back.
Yeah, it's actually not something that you get rid of completely. So it's sort of a maintenance thing. It's kind of like a chronic illness.
Okay, so it's never a permanent fix.
It's never permanent. We can make you look a lot better, and then, as I said, the defenses of stockings, which most people are horrified by. But they're much better now. If you actually go look, they make sheer socks that are actually acceptable.
Thank you, Dr. Riccio.